Hello, I am Dr. Jagdish Hiremat. I am a practicing cardiologist from Pune. Uh, On the occasion of the World Heart Day, some medical information will come to you, and that is about chronic heart failure. Heart failure is a term difficult to understand for non-medical people. So in short, let's say that heart is not doing adequately enough. In a minute, heart is supposed to pump out about 5 liters of blood. But when it becomes weak or non-functional or is not effective enough, it will pump 4 per minute. It will pump 3.5 liters per minute. And this terminology is called as a heart failure. Actually, what happens in heart failure is, for some reason, whatever could be the reason, the all four chambers of the heart could dilate or they become bigger. Their contractility becomes less, the effective pumping becomes less. And that's why, in return, the cardiac output or the blood coming out of the heart for the body starts dropping all the way. And this also is known as heart failure. The causes of heart failure are quite a few, actually, because heart, as you can imagine, is made out of the heart valves, the heart muscle, the plumbing system of the heart, which the coronary arteries, and the electrical system of the heart, which maintains the heart rhythm. All four of these can go wrong and result into heart failure. For example, there could be a heart attack because of the coronary artery blockage. Part of that heart gets damaged permanently, and then the heart, from instead of 100% capability, comes down to 50%. Obviously, it's going to have a heart failure. Let's say a valve of the heart starts leaking. That means it's not doing an adequate job. So it will result into a lot of strain on the heart, and the heart will then start tiring out. The heart muscle, which pumps the blood, can go weak, maybe, for example, due to chronic alcoholism, and then the pumping capacity of the heart comes down. The heart can become abnormally slow or fast, as in a rhythm disturbance. And sometimes there could be abnormalities of the heart arising right from the birth. All these 4 or 5 factors can lead to ineffective pumping of the heart, which is called as a chronic heart failure. Based on this, what causes heart failure, obviously we can make out what the risk factors could be. For example, with advancing age, the heart muscle can get tired, long-standing diabetes, long-standing blood pressure, a previous heart attack, or sometimes other ailments like heart muscle damage, heart muscle not doing good enough because of some substances like foreign substance like amyloid get into these heart muscle. All these are considered so-called risk factors, which will in effect affect the heart contractility, heart pumping, and that results into heart failure. When a person suffers from heart failure, obviously the pumping goes down, the forward output from the heart goes down, and that's why there is fatigue. The muscles don't get enough blood to work, and that's why there will be generalized fatigue. At the same time, there will be backward pressure because the forward blood is not getting pumped out. It results into backward pressure. The fluid will collect in the lungs, causing breathlessness. Such a person may not be able to lie down flat. He has to sit up to feel comfortable. There could be swelling of the feet. There could be enlargement or congestion of the liver causing loss of appetite. So fluid retention, with whether it is in lungs, whether it is legs, or whether it is organs or liver, would feel its make its impact felt. Once we know what is a chronic heart failure, we have to know a new terminology called worsening heart failure. That means the person is, suppose, a known heart failure for some time, is on treatment, is regular with the medication, is regular with the other aspects of management. He would go on steadily for a number of months or years. But one day, suddenly, because the original disease process gets worse, he will get admitted in the hospital, which is called as the acute decompensated heart failure or ADHF. This is a worsening of the heart condition. Any hospital admission for a worsening of the heart failure would mean that the heart is getting worse and worse, and the original disease is getting um, problematic. Worsening heart failure always is also diagnosed when a stable patient who was otherwise taking medication and going on now gets out of breath, comes to a doctor early, and the doctor has to increase his medication. That's also worsening heart failure. So all three, four aspects of it, admission for decompensated heart failure, or increase in the or escalation of the medicine required, or a visit to the emergency room, are considered worsening heart failures. Worsening heart failure means the outcome of this individual is getting worse, the disease is getting worse, and the long-term outcome, that means the life gets shorter, and henceforth the person is likely to get repeated admissions in the hospital and spiraling down, both by way of health and by way of shortening of his lifespan. Heart failure is very well managed by what is known as four pillars of management. There are four drugs which have been proven effectively in the management of this heart failure. And when put together, they do a remarkable job. The person gets relief of his symptoms, also extension of his life, sudden cardiac deaths get prevented, and the overall outlook gets better with what is known as GDMT, or guideline directed medical therapy. Despite that, the person can get worsening heart failure. And this is where the problem starts, because this is a unmet need. Out of, especially almost 1 out of 7 individuals on proper doses of this four drug can get into decompensated state, can develop worsening heart failure. So obviously there is a gap in which or more medication is required, something different is required other than the four pillars which are established. And of course, world is moving in that direction of development of such medication. If I diagnose a patient as a worsening heart failure, some reflexes have to come to me, in the sense I'll see if the physical activity is getting too much or not. Suppose a person is doing too much exercise unnecessarily or getting stressed out in his job situation, then such a things are curtailed and adequate rest is advised to such a person. In a worsening heart failure situation, the fluid restriction gets tighter. That means if the person was consuming, say, 1.5 liters of total liquids per day, it would be curtailed down to 1 liter per day. Also, the added salt and the salty items in food will be curtailed strictly, and there is strict salt restriction, because salt and water means added burden on the heart, and we don't want to have this added burden when the person is developing worsening heart failure. So adequate risk, curtailing of the physical activity, curtailing of salt and water are the related to lifestyle changes. Also, I would ensure adequate sleep for this individual so that the heart gets rested during sleep also. Then comes the management of the drugs. Apart from the four pillars of treatment of heart failure, one would think of extra drugs which are available. And of course, we'll sort out things like their sodium balance, the potassium balance. If the hemoglobin is less, then correct that by giving some therapy. And all these peripheral action also help a lot. Reducing the heart rate from a baseline of say 80 to 70 to 65 also great helps a great deal for management of worsening heart failure. This is also a time when mechanical therapies are sought of. For example, some people can get a pacemaker, which for managing of this patient, and ultimately the left ventricular assist device or heart transplantation are thought of when one realizes that this is an end stage heart failure Now the medical therapy has come to its brink. The life expectancy is now less than 1 year. That's the time the mechanical therapies also come into foray. It's quite difficult to live with a disease which can kill. In fact, it is said that a risk of a heart attack, if say X, then the risk of a heart failure is almost 10 times more than that. So it is a disease which is akin to high grade malignancy. It kills, and the death rate of these patients is fairly high. So living with worsening heart failure is identifying it, reporting it to the doctor, doing daily weight at home. Suppose you weigh yourself daily, and if you put on 2 kilograms in 2 days, that means fluid buildup is started, and you would curtail on that and make some changes in the medication as well. Reporting the symptoms to doctor, recording your blood pressure and pulse almost every day, managing your activity in such a way that you are active but yet not getting exhausted. That kind of a balance can be obtained on this. Of course, one has to be regular with medication, regular with the blood tests that are ordered. There are some blood tests which would check on the strain of the heart, and these blood tests can be periodically performed by the doctors. All in all, worsening heart failure is a difficult ball game. It's a disease where the person is now spiraling down into a negativity related to the length of life and quality of life. So tightening of all these aspects of correct salt and water restriction, physical activity, regular medication, visit to a doctor, and thinking of therapies which are beyond the normal mechanical medical treatment have to be offered to these individuals. Thank you, viewers, for joining in and listening to this information related to worsening heart failure. On this World Heart Day, I hope this information comes to you as useful.